And so this is also comes back to Dr. Ying Chen's question earlier. What about thoracic discectomy with or without fusion? Because a lot of times this is the spinal cord. In the thoracic disc, we can't retract the spinal cord, unlike you can in a TLIF. You can retract the thecal sac a little bit with a nerve root retractor, right? But you can't do that in a thoracic disc because that's a spinal cord. Spinal cord thoracically in the thoracic portion is highly intolerant to retraction. You can get loss of motor verb potentials, you get hemiparesis, you get Brown-Séquard syndrome. These are all the dreaded complications of a thoracic disc. So because of that, with the Dreal tool, we can now safely reach underneath the spinal cord with the curved down pushing tool that we were showing earlier, and then cut down, push down the osteophytes, push down the calcified, shave the calcified discs with the shielding of this against the dura, and therefore do a gradual controlled resection of the disc, and then get into the inner body space, if you will, and resect the disc again in a down pushing controlled fashion without you having to put big tools down there to prepare the inner body space. So again, you definitely, Dr. Ying Chen, can use this tool to achieve an excellent, safe, slow, but safe decompression of a calcified disc fragment. And of course, prepare the inner body space if you so choose to do a fusion as well at the thoracic disc space. And here you can see the pre and the post MRI report showing that. And again, this has been reported using safe thoracic discectomies, same authors, Dr. Ashkenazi, Dr. Butler, Rick Geyer, Talakovsky, and you can see that that this can be achieved with a unilateral device approach, safe neurological decompression from partially calcified discs that are not too exophytic. Obviously, big, huge exophytic calcified discs should, I'll be the first to say, it should be approached from an anterior approach. But the paracentral, not so mushroomed, partially calcified disc can still be approached from a costotransverse, transpedicular far lateral approach with this tool safely, and you can decompress and gradually work the calcified disc into a hole safely with these tools as well. And that's what this paper fundamentally showed. They had 12 patients with posterior thoracic discectomies, and these were all safely done, and showing that it's not only safe, feasible, but it's also very safe.